Want to earn over $50,000 a year while making a real difference in people's lives? Let me show you how. If you want to become a nurse but don't want to spend 4 years in a classroom, then becoming an LPN might be the perfect career move for you. In this A to Z guide, we'll walk you through exactly what an LPN is, what they do, how much they earn, and how you can start your nursing career with Clarys Advanced Nursing Education. First, let's define it. An LPN is a skilled healthcare professional trained to provide essential hands-on nursing care. While they work under the supervision of registered nurses and physicians, they play a massive role in patient health, especially in long-term care, clinics, and home health settings. So, what's the difference between an LPN and an RN? It mostly comes down to education time and scope. An RN usually completes a 2 to 4 year degree. An LPN, however, can finish their program in just 12 to 18 months. While RNs handle high-level care plans, LPNs are the true backbone of frontline patient interaction. What does an LPN actually do on a daily basis? The role is incredibly hands-on and meaningful. On the clinical side, you are the eyes and ears of the medical team. Your duties will include taking vital signs, administering medications depending on your state regulations, performing wound care and dressing changes, and collecting lab samples. Beyond the medical tasks, there is the human element. You'll assist with daily activities like bathing, feeding, and mobility, while providing crucial emotional support to patients and their families. Finally, there's documentation. LPNs chart patient data and report any changes to the care team. Accurate documentation is a vital part of keeping patients safe. To become an LPN, you don't need a university degree, but you do need to complete an accredited practical nursing program. The requirements are straightforward. You generally need a high school diploma or GED and passing scores on a placement exam. The best part? It's fast. A full-time program can be completed in as little as 12 months, while part-time options usually run 18 to 24 months. Once you graduate with your certificate or diploma, you are qualified to sit for the 𝗀𝗏𝗄𝗏 exam. One of the biggest advantages of this career is flexibility. LPNs are needed everywhere. In hospitals, you'll support RNs and monitor patients in a fast-paced environment. In long-term care facilities, which are the biggest employers for LPNs, you'll manage medication rounds and oversee the daily care of elderly residents. You can also work in home health, providing one-on-one care and chronic disease management in a patient's home, or in clinics and assisted living centers, helping residents maintain their independence. Now, let's talk about the numbers. How much do LPNs really make? On average, LPN salaries in the U.S. fall between $50,000 and $62,000 per year. However, this varies heavily based on your location, your experience, and the setting you work in. For example, LPNs in specialized care or agency work often earn more. Ready to begin? Here's what you'll need to get started. Prepare your GED or high school diploma and be ready to take an entrance exam. You will also need to pass a background check and have your required immunizations up to date. It might sound like a lot, but you don't have to do it alone. At Clarys Advanced Nursing Education, our admissions team supports you through every single step, making your path to enrollment smooth and achievable. Becoming an LPN is one of the fastest, most secure, and most rewarding ways to enter the healthcare field. It's a career with a future. If you are ready to take that next step, Clarys Advanced Nursing Education is here to help you build a strong, confident foundation. Click the link below to learn more, speak with an advisor, or start your application today. Your future in nursing begins here.